So my name is Chad Hills. I am a board certified orthopedic surgeon who has specialty training in dealing with hip and knee replacements primarily within the adult community. So the total knee replacement procedure is really geared towards improving your function and hopefully lessening your pain. The majority of people do get relief from their pain, but it's truly a process and it takes time. At this point, you've already been through what I would consider the easy part. The surgery's over, you get to take a nap for that, but now it's on to the recovery phase, which is a little bit more challenging from your perspective, just because really it's a lot of work and it takes time and effort. And the effort starts today. And so ultimately, as you continue through this journey, goal number one, regain your motion. Number two, help with your swelling. And in so doing, your walking will become better and your overall quality of life will eventually catch up to that as well. After surgery, it's really important to make sure that you take overall general good care of your health. Diet is a very big factor in this. And so make sure that you have a very well-balanced diet. I want you to increase your protein intake. Protein is very important to you in order to help you heal your incision and to generally have a quicker recovery. Your body needs that building block in order to heal everything up. So increase your protein intake. That could be in the form of dairy, yogurts, cheese, and even general meats such as chicken, etc. Red meats do have a little bit of extra iron in them as well, and that can help you combat the anemia that can sometimes occur after surgery as well. For some people, if you just feel very, very tired and fatigued, taking an iron supplement will help also restore that anemia to improve your overall function. Pain is expected after any surgery just by the nature of it, and we really attack pain in a variety of ways. We call it a multimodal approach. This can be in a variety of ways, and most commonly we use an anti-inflammatory to help control inflammation. And the anti-inflammatory that I typically use is referred to as Celebrex. It's less damaging to the stomach lining and can usually be very well tolerated for people who don't have an allergic reaction to such. So if you aren't taking an anti-inflammatory normally or before surgery, that's usually the one that I will start people up on. If you are taking something such as meloxicam, ibuprofen, or naproxen, then I will usually continue those after surgery. In addition to that, we use Tylenol. Tylenol has been shown to be very effective in helping control postoperative pain. So the Tylenol, you can take 1,000 milligrams every 8 hours. On top of that, if the Tylenol alone isn't cutting it, I will prescribe you most commonly oxycodone, and that you can take 1 every 4 hours. And then eventually we want you to slowly start weaning down away from the oxycodone to where you're just using the Tylenol or the anti-inflammatory as long as you can tolerate those just fine. Some of our goals after surgery are to really help you get off the narcotic medications as soon as possible, because there can be side effects with these medications. One, they can be addictive, but two, they can also cause constipation, and that can be quite a challenge to deal with. So oftentimes, while you are taking the narcotic medications, a stool softener or a laxative may be necessary. One of the common ones that I prescribe after surgery is the Senocide or Senocot, and that will help to move things along. Increasing your fiber and or even taking a fiber supplement, having a good vegetable diet will also help to move things along for you. Occasionally, some people do get some itchiness with the narcotic medication as well, so things such as Claritin may be of benefit to help as an antihistamine to help reduce some of those symptoms. Nausea is another thing that can be somewhat challenging for some patients. And so one thing that we found to help out most is to actually make sure that you have something in your stomach before you take those medications. So other medications that I prescribe after surgery are geared towards blood clot management. Our goal is to help make sure that you don't get these blood clots because they can travel to the lung and potentially cause a pulmonary embolism. So aspirin is the typical go-to medication for me. It's an 81 milligram, oftentimes referred to as a baby aspirin, and that's taken once in the morning and then one at night. For some people who don't tolerate aspirin or are otherwise contraindicated due to allergy, etc., we'll prescribe usually Eliquis at 2.5 milligrams twice a day to help prevent those from occurring. So in terms of managing your dressing, It should be pretty simple. Covering the main dressing is an ACE wrap as well as a cotton pad that surrounds everything. Those are usually taken off the morning after surgery. The main dressing, the brown one that you'll see underneath covering your incision itself, is left in place for 5 days. That dressing is waterproof, so the day after surgery, once you remove the ACE wrap, you can begin to shower normally. Of course, the goal isn't to submerge the wound or the incision, but rather just have some light water kind of spray over it. Try to keep it out of the direct beam, and you can use some soap very lightly around and then pat everything dried. I would caution though, if you see that the dressing is peeling up at all, don't take a shower at that time because we don't want any water getting near the incision. Moisture will increase your risk of infection, so we want to keep everything as dry as possible. After 5 days, the dressing can be removed. It's a little bit tacky, and so just gently peel it away, and it almost will look a little bit gummy as it's coming away. But take your time, it maybe about a minute or so to get the full thing off, and then you can begin to shower normally without having to cover it anymore. Upon returning home, things that are important to look out for are fevers, chills, and any drainage. I get really concerned about any drainage after surgery. So if there is an excessive amount of drainage, anything that is bigger than a quarter on your dressing, please reach out so I can discuss things a little bit further with you. Other than that, expect to see swelling of the knee. With that will come warmth as well. A lot of people get really concerned when it gets so warm that they like, wow, I might have an infection. But infection immediately after surgery is very, very rare. So expect to see warmth and to feel it. Sometimes it even gets a little bit red. Bruising is very common. You'll see sometimes bruising all the way back behind the knee, sometimes up around the thigh. And it really depends how much you're up and about. For those people who are standing more often or their leg is in a more dependent position, the bruising can actually travel sometimes all the way down to the ankle. So don't be too alarmed about that. At any time, if there are any concerns, please do not hesitate to reach out to our office or my surgery scheduler. We try to be readily available at any point to be able to discuss any concerns that you may have. In fact, within our office staff, we have a doctor that's on call 24/7, so please do not hesitate to reach out if you have any questions at all. There are no dumb questions. Again, I really hope that you have a good recovery. I'm excited for you in this process. Thanks for taking the time to watch this.